Livestock Health 3 Diseases. Introduction. A livestock disease is any alteration in the state of the body of the animal or its organs which interferes with the proper performance of its functions. One cause of low production in livestock is infection by various diseases. Farmers must therefore have knowledge of common diseases that affect livestock. Protozoan diseases. Protozoa are unicellular organisms capable of causing diseases in livestock. Common examples of protozoan diseases include trypanosomiasis, anaplasmolysis, and East Coast fever. These are diseases caused by protozoa. Examples include East Coast fever, anaplasmosis, coccidiosis, and nagana. East Coast fever. East Coast fever is caused by protozoa known as Theileria parva, which is transmitted by brown ear tick. It mainly attacks cattle and has incubation period of 15 days. East Coast is mainly characterized by the swelling of lymph nodes, especially those around the base of ears, shoulders, and stifle joints. High fever, profuse salivation, a lot of tears coming out of the eyes. Coughing and difficulty in breathing are also common among infected animals. Control measures of East Coast fever. Control of East Coast fever requires rigid control of the vector tick. All animals moving from non-exotic to exotic areas, and particularly non-zebu cattle, should be totally prevented from being infested by ticks. East Coast fever can be controlled through treating infected animals using appropriate drugs and through effective control of ticks. Coccidiosis. Coccidiosis is caused by Coccidia of Eimeria species. It affects mainly poultry, calves, kindlings, kids, and lamb. Major symptoms of coccidiosis include rough plumage, drooped wings, dysentery, and dullness in infected animals. Coccidiosis has an incubation period of 7 days to 4 weeks. Trypanosomiasis. Trypanosomiasis affects cattle, pigs, sheep, and goats. It is caused by protozoa Trypanosoma species transmitted by seseflies. Incubation period of trypanosomiasis is 1 to 3 weeks. The major symptoms are high fever, dullness and loss of appetite, lacrimation, swollen lymph nodes, loss of hair at tail end and reduction in milk production, anemia, and rough coat. Anaplasmosis. Anaplasmosis is caused by a protozoa, Anaplasma marginale, transmitted by blue tick, which is called Buphilas decolaratus. Anaplasmosis has an incubation period of 3 to 4 weeks and can be transmitted through contaminated surgical instruments and hypodermic needle. Anaplasmosis is characterized by anemia, constipation, high fever, and low production of milk in lactating cows. Bacterial diseases. These are diseases caused by bacteria. Examples include mastitis, contagious abortion, foot rot, and anthrax. Examples of other bacterial diseases affecting livestock are scores, black quarter, and pneumonia. It mainly attacks cattle, sheep, goats, and pigs. Mastitis. This is an infectious disease of the mammary gland which can be acute or chronic. It is characterized by inflammation of the udder. Mastitis is characterized by inflammation of the udder, presence of pus in milk, death of infected quarter, and during suckling, the animal kicks due to pain. Predisposing factors of mastitis. Predisposing factors are those factors that lead to an animal attracting a disease. In mastitis, they include age, stage of lactation period, type of udder attachment, and poor sanitation. Among the important predisposing factors of mastitis is the poor milking technique, which may result in a mechanical injury of the teats and weakening of the sphincter muscles of the teat. This leads to mastitis attack since the pathogens can easily enter through the wounds. Control measures of mastitis. Effective control of mastitis requires strict cleanliness within the dairy shed. Detecting mastitis using a strip cup and immediate treatment of wounds, especially on the udder, are known to stop the spread of the disease. Other control measures against mastitis include using the right milking techniques, teat dipping, improved farm hygiene, and prevention of wounds on the teats. Foot rot. Foot rot is an infectious and contagious disease which affects all cloven-hoofed animals. Take 2. Which affects all cloven-hoofed animals, for example, cattle, goats, and sheep. It is caused by bacteria of the Fusiformis family. In sheep attacked by foot rot disease, the foot becomes swollen, limp while walking, and rotten smell coming out of the hooves. In most cases, the sheep is found lying or kneeling when grazing. Control measures of foot rot. Control of foot rot can be effectively achieved through provision of clean environment, foot examination and trimming, wound treatment, and grazing sheep in dry pasture fields. Apart from hoof trimming, foot rot can be controlled through farm hygiene, use of foot bath, wound treatment, and isolation of sick animals. Fowl typhoid. Fowl typhoid is caused by Salmonella gallinarum and it attacks domestic birds, for example, chicken, turkey, and ducks. Fowl typhoid is characterized by depression, dullness, greenish-yellow diarrhea, anemia, and drooping wings in birds. It can be controlled through proper disposal of carcass, regular vaccination, improving hygiene in poultry house, and obtaining chicks from reliable sources. Infected birds can be treated using sulfur drugs mixed in water or in mash. Contagious abortion. Contagious abortion is caused by Brucella abortus in cattle, Brucella suis in pigs, and Brucella melitensis in goats and sheep. Contagious abortion is characterized by spontaneous abortion, retained placenta, low libido, and otitis in bulls. A yellowish-brown, slimy, odorless discharge from vulva may occur after abortion. Control measures of contagious abortion. Bacterial scores. Bacterial scores attacks calves, piglets, lambs, and kids. It normally attacks young animals in their first week of life. Unhygienic conditions and poor feeding do expose the young animals to bacterial scores. Symptoms of bacterial scores include white or yellowish diarrhea, pungent smell of feces, high fever, loss of appetite and sunken eyes. Restlessness and presence of undigested milk and mucus with blood spots in feces are noticed in infected livestock. Control measures of bacterial scores. Bacterial scores can be controlled through maintaining farm hygiene, ensuring dry flow in livestock houses, and disinfecting calving pens. Replace the feeding of milk with warm water mixed with glucose for the first 3 days as soon as the first symptoms are observed. ensure raised floor in calf houses, and have separate attendants for the infected calves in order to avoid spread of bacterial scores. Infected calves should be promptly treated with appropriate antibiotics. Black quarter or black leg. This is an infectious disease which affects all ruminants animals aged between 8 to 18 months old cattle, sheep after shearing, and goats. Black quarter is caused by a bacteria known as Clostridium chauvei and Chauvei septicum, which is spore-forming. It is found permanently living in the soil, and it is difficult to eradicate once prevalent in a place. Symptoms of black quarter. Black quarter is characterized by high fever, lameness, swelling of the affected body parts, loss of appetite, and dullness in infected livestock. It can be controlled through vaccination, proper disposal of the carcass, treating infected animals with antibiotics. Heavy and faster breathing is common among infected animals. Also common is grinding of teeth, blood oozing from nose and anus of the carcass, muscles of dead animals appearing dark when cut. The sick animals stop chewing the cud. Bloody froth having smell of rancid butter and crackling of the swollen parts are common symptoms in black quarter. Anthrax. Anthrax is an acute, infectious, and unnotifiable disease. It is caused by Bacillus anthracis found in the feces of the infected animals. Anthrax is associated with the swelling of the underside of the body and high fever. There are blood stains in feces and milk, and swelling in throat, especially of pigs. Carcass lacks rigor mortis and produces star-like watery blood through the orifices. Spread of the anthrax can be prevented through proper disposal of carcass, quarantine, and vaccination. Pneumonia. Pneumonia is caused by bacteria Mycoplasma mycoides. It affects young animals, mainly calves, kids, lambs, piglets, and poultry. Factors which predispose pneumonia include poor ventilation, overcrowding, young age, and effects of diarrhea and other illnesses. Pneumonia is characterized by dullness, loss of appetite, rough hair coat, rapid breathing, emaciation, nasal discharge of mucus, and reluctance to move in livestock. Abnormal lung sounds, coughing when chest is pressed, and fluctuating body temperature are common in infested livestock. Ensure farm hygiene, isolation of infected animals, provision of warmth in livestock houses, and treatment using appropriate antibiotics to control pneumonia in livestock production. Viral diseases. These are diseases caused by viruses. They include rinderpest, foot and mouth disease, Newcastle, foulpox, gumboro, and African swine fever. Viral diseases are caused by viruses. Common examples among livestock are gumboro, foot and mouth disease, and Newcastle. Newcastle diseases. Newcastle diseases is highly contagious and infectious disease. It mainly affects poultry at ages of 3 months and 1 year and has an incubation period of 5 to 7 days. Affected birds show difficulty in breathing, lack of appetite, are dull, and have beaks which remain wide open and strained necks. Apart from hoof trimming, foot rot can be controlled through farm hygiene, use of foot bath, wound treatment, and isolation of sick animals. Major symptoms of Newcastle in poultry include nasal discharge which forces the birds to shake their heads, eyes closed all the time, staggering motion, and production of watery greenish diarrhea. Production of soft-shelled eggs and drooping wings are noticed in birds that are infected by Newcastle. To control Newcastle, farmers are advised to kill all infected and in contact birds. Poultry house should be cleaned and disinfected before bringing in new flock. Vaccination and quarantine have been effective in controlling Newcastle. Fowl pox. This is an infectious disease of poultry. Animals affected include chicken, turkeys, pigeons, and other birds. It is caused by a virus known as avian pox, which has an incubation period of 3 to 14 days. Presence of wounds and biting insects can expose the birds to fowl pox disease. In birds affected by fowl pox, there are lesions on combs and wattles. In severe cases, birds lose appetite, become dull, and their eyes and nose discharge watery fluid. Fowl pox can be effectively controlled through vaccination and mass slaughter of infected and in-contact birds. Gumboro disease. Gumboro attacks chicken, turkey, pigeons, and ducks. It is caused by Birna virus and has incubation period of 2 to 3 days. In birds infected by Gumboro, there is swelling of the vent, decrease in egg production, respiratory distress, and loss of appetite. Affected birds by Gumboro show low water intake, severe immune suppression, and high mortality rate, especially in hot weather and humid conditions. It can be controlled through vaccination and proper feeding involving vitamins, especially vitamin B12. African Swine Fever. African swine fever is a highly contagious, infectious, and fatal disease of domestic pigs. It is transmitted through direct contact with the infected farm structures and reservoir. It is caused by iridovirus and has incubation period of 5 to 15 days. Symptoms of African swine fever include high fever, lack of appetite, general body weakness, coughing, and nasal discharge. African swine fever can be controlled through vaccination, quarantine, proper disposal of infected pigs, and double fencing to keep off wild animals. There should be no consumption of pork from pandemic areas to avoid spread of the disease to man. Rinderpest. Rinderpest is highly infectious and a contagious disease. It is a viral disease which mainly affects cloven-hoofed animals, for example, cattle, sheep, goats, and pigs. Livestock attacked by rinderpest are characterized by high fever, eyes appearing watery, discharge in mouth and nose, grinding of teeth, diarrhea, and are emaciated. The incubation period of rinderpest is 3 to 15 days. It can be controlled through vaccination every 6 months. Quarantine and mass slaughter of affected and in-contact animals are also effective measures against rinderpest. Nutritional diseases. These are diseases as a result of poor feeding in livestock. They include milk fever and bloat. Nutritional diseases are non-infectious and may affect various farm animals, for example, lactating cows. Milk fever. Milk fever is caused by low calcium levels in blood. It mainly occurs in high-producing cows. Milk fever mainly attacks cows that have recently calved and are high milk producers. Goats and pigs in similar conditions may be affected. This is because these animals lose more calcium through milk secretion than they are getting from the diet. Symptoms of milk fever. Major symptoms of milk fever include dullness, muscular twitching, animal lying down on one side, lung fever, and complete loss of appetite. Animals suffering from milk fever can be treated using an intravenous injection of soluble calcium salt in form of calcium borogluconate. Farmers should implement partial milking for the first 10 days. Bloat. Bloat is the accumulation of gases as a result of food fermentation in the rumen. It mainly attacks ruminants, for example, cattle, sheep, and goats. In livestock affected by bloat, the left side of the abdomen is extensively distended due to gases which can be felt by pressing with the hand. Accumulation of gases in ruminant animals can be caused mainly by obstruction of the esophagus due to bulky food particles and indigestion. Bloat can easily be controlled using trocar and cannula, feeding livestock with lush pastures which have been wilted, and administering appropriate chemicals, for example, Epsom salt.